Regular monitoring is the backbone of successful hormone therapy. It's not just about starting patients on the right treatment. It's about making sure their therapy stays effective and safe over time. Monitoring allows us to track progress, make adjustments, and address any risks or side effects early. In this part, we are going to explore why monitoring is so essential and how to implement effective protocols in your practice. Why is regular monitoring so important? There are three main reasons for this. First of all, it ensures safety by catching any adverse effects or imbalances early. Second, it optimizes therapy by allowing for adjustments based on the patient's response. And third, it supports personalized care by tailoring the treatment to the patient's changing needs. Let's break this down. The first step in any monitoring protocol is establishing a baseline. This means conducting initial lab tests to determine the patient's starting hormone levels. Baseline testing provides a clear picture of where the patient is starting from and helps us set realistic goals for their therapy. It's also essential for identifying any pre-existing conditions or risk factors that might influence treatment. Once therapy begins, follow-up testing is critical. Typically, we recommend testing every 3 to 6 months, although this can vary depending on the patient's age, health status, and specific treatment plan. These follow-ups allow us to track hormone levels and see how the patient is responding to the treatment. If any issues arise, like side effects or a lack of improvement, we can address them quickly and effectively. So which hormones should we do monitoring? The key players are estrogen, testosterone, thyroid hormones, and cortisol. Each of these hormones has a specific role in maintaining balance and supporting anti-aging. Monitoring the levels helps us assess the overall effectiveness of the therapy and make any necessary adjustments. Regular testing ensures that we are not just guessing, we are making data-driven decisions to optimize outcomes. Interpreting the lab results is another critical part of the process. We look at three things: reference ranges, optimal ranges, and individual factors. Reference ranges give us a general idea of what is considered healthy. But for anti-aging, we are often aiming for optimal ranges that promote vitality and wellness. Finally, we interpret these results in the context of the patient's symptoms and overall health. This personalized approach ensures that the treatment aligns with the patient's unique needs. Tracking symptoms is just as important as tracking lab results. Patients might notice changes in energy levels, mood, sleep quality, or physical well-being. By monitoring these symptoms alongside lab results, we get a more complete picture of how the therapy is working. For example, if a patient's lab result looking good, but they are still feeling fatigued, it might be a sign that we need to adjust their therapy or address another underlying issue. Side effects and risks are always a consideration in hormone therapy. Regular monitoring helps us identify side effects early, whether it's mood changes, weight fluctuations, or skin reactions. We also watch for potential risks like cardiovascular or liver-related issues. If we see any warning signs, we can adjust the dosage, explore alternative therapies, or take other steps to ensure the patient's safety. Adjusting dosages of hormones is an art as much as it is a science. Changes should be made gradually to minimize adverse reactions and give the body time to adjust. Patient involvement is key here. Explaining why adjustments are needed and how they'll benefit helps ensure adherence of patient. Using lab results and patient feedback to guide these changes ensures that every decision is data-driven and personalized. Documentation is another critical part of monitoring. Keeping thorough records of lab results, symptoms, and treatment adjustments is essential for tracking progress and ensuring legal compliance. It also helps us make informed decisions over time, adapting the therapy as the patient's needs evolve. Accurate records are the foundation of effective and ethical hormone therapy.